So the leg club itself is just a phenomenal way of sort of implementing care to patients. It's like going into a coffee morning almost. So you've got patients who come into clinic, they're literally sat there, they're not able to communicate, they go see the doctor, and ultimately they come home with potentially a treatment or a tablet or potentially a dressing. Whereas the Lindsay Leg Club itself, you can go in there, you have support, and it is literally, I've sort of attended some of the leg clubs, and it's like going into a coffee morning in the olden days, if they still sort of exist. But again, they can interact with each other, they can communicate. And again, compliance with wound care is essential because a lot of patients do not see the benefit of they're putting a dressing on, it hurts, they take it off. Whereas in a leg club, they can chat with each other, they can chat with other health professionals. A lot of the leg clubs sort of even have doctors on side, they have podiatrists. Again, it depends how the leg club's actually set up, but there are just so many sort of, it's a social gathering almost, where you go for your treatment. And again, even just that attending a leg club, it's kind of your own self-worth and your self-care, if you like. So patients are literally coming in, they're committing themselves to go to a clinic, and the clinic itself is just, it's phenomenal. At the end of the day, everybody I speak to sort of said it's just a great organization. It's like a social outing. And then they can even communicate with each other and sort of say, oh, well, I do this, I do that. So it's an education for the patients as well, really. The clients, should I say, however you want to sort of phrase it. But there are just so many things that they can sort of learn by going to the leg club sooner than going to a hospital clinic. I think everything now is sort of about prevention. So at the end of the day, if they're preventing sort of issues, identifying potential problems early, again, that can sort of impact on the longer term treatment. So again, everything in the NHS is obviously it's a business, saving money. So again, that whole prevention side of things is really important. And again, that can be sort of done within the leg club. And again, that sort of whole bringing patients together, it's the whole sort of package of the leg club whereby you can sort of benefit so much from sort of seeing different things. It's not a clinic, it's not a medical facility as such. It's more a social gathering, but it's all about sort of training and again, allowing time as well. Time is so important in the NHS. Again, you go to a clinic, you have a 10-minute appointment. Potentially within a leg club, if a patient needs more than 10 minutes, again, you can do the dressing, but again, you've got time then to interact. So there are so many benefits of actually doing things in the community. The patient wants to come, they want to be spoken to, they want to have chats, they want to discuss, and potentially there are lots of things that can be picked up at the leg club, potentially move sort of patients on to other types of treatment, diagnosis even. And again, that's kind of like a preventative thing. They can sort of identify other things, even high blood pressure. Again, they get blood pressure checks, vascular assessments. There are so many things that can be picked up in the community sooner than in a GP practice where you're limited to a 10-minute appointment.